Good afternoon, everyone, and thank you all for being here. I'm Dr. Dan Carey, President of Corewell Health, William Beaumont University Hospital. I want to give a special thanks to Governor Whitmer, to Representatives Dingell, Tlaib, and Stevens. I believe Oakland County Executive Coulter was trying to make it. Hope he was able to. And Mayor Fournier also was trying to make it here from Royal Oak. Thank you for joining us here today to help protect the Medicaid program. We are here today to oppose Medicaid cuts that would threaten access to care for our most vulnerable neighbors, including children, seniors, and individuals with disabilities. Medicaid is a critical safety net program that impacts millions of lives across our state. 26% of Michigan residents rely on Medicaid coverage. Nearly 50% of all Michigan children and 6 out of 10 elderly adults rely on Medicaid for their health care. Medicaid isn't just coverage, it's a lifeline. In my role, I have a responsibility to think about how we provide care to those in need. These proposed reductions would put enormous strain on our patients, hospitals, and health systems, many of which are already operating under tremendous pressure as we face rising pharmaceutical costs and below average reimbursement by insurers here in southeastern Michigan. Here at Royal Oak, Medicaid covers nearly half of all kids at Corewell Health Children's. If this passes, what happens to those kids and our communities, including our healthcare workforce who care for these children? These are the critical questions and challenges we will face as doctors, nurses, and caregivers if these cuts are made. Once again, thank you to those who are joining us today to protect our communities. I'm honored now to turn it over to a true champion for healthcare access, someone who has consistently fought for the dignity and well-being of every Michigander, Congresswoman Debbie Dingell.
Thank you, Dr. Carey, and thank you to Corewell for letting us be here today to talk about what's really at stake for the people of Michigan, and to the governor for her leadership. Congressional Republicans have proposed the biggest cuts to Medicaid in history, which jeopardizes millions of Americans' health care coverage, including 2.6 million Michiganders. On May 7th, the Energy and Commerce Committee, of which I am a member, will have our budget reconciliation markup, where Republicans have been directed. They're trying to direct us. Nobody is going to direct me to do this. Let me make this clear. To cut $880 billion in spending. And if they do that, there is simply no way to do it without drastic cuts to Medicaid. And let me make this very clear. We will make sure every Republican is on record on what they are cutting. Children's health care, disability health care, long-term care for seniors. Medicaid is already a lean program, with few options for how to fill the budget hole left by cuts to Medicaid funding. States will be forced to consider cuts to coverage and benefits, leaving more people uninsured and underinsured. I did another event with the governor about 2 weeks ago. The doctor just talked about how much of Corewell's is funded or supported by Medicaid. I want Children's Hospital in Detroit, 75% of the children there are covered by Medicaid. What will those children do if they don't have coverage? And Medicaid is also the primary payer of long-term care in America. I was with seniors on Tuesday, and one of them said, if they cut Medicaid, will they throw my husband out? of the nursing home. He has Alzheimer's. What will I do? What do we tell seniors and parents? What will we do? Any cut will place an enormous financial burden on parents, older adults, people with disabilities, and their families, and especially those who have already spent down their assets and resources to qualify for Medicaid. Americans would have to forego much needed care entirely, or their family members would be forced to choose between covering their children's expenses, saving for their own retirement, or even being able to help their loved one. We're speaking up to share the stories of people who will be hurt. Please, all of you, help us share that stories. These are not statistics. These are human stories. We have good news. In the last week, several Republicans in Congress have publicly come out against serious cuts in Medicaid. We have till May 7th, when the real work begins, and from committee will then go to the floor to make sure that every Michigander, we all fight about what word we use, Michigander, understands what's at stake. I will do absolutely everything I can to defend Americans' health care and prevent millions of Michiganders from losing their coverage. And I thank Governor Whitmer and all of our partners here today for being in the efforts for this fight. And now, no stranger to not being willing to fight, to defend the people of her district, to always be there for those that need a helping hand. Please welcome the Congresswoman from the 11th District of Michigan, in which district we are in, Congresswoman Haley Stevens.
Thank you. Well, thank you, Congresswoman Dingell, and thank you, Dr. Carey, and to every stakeholder here today, our incredible medical professionals, our doctors, our nurses, our social workers, our friends from organized labor, AFSCME, and SEIU, and all of you here who are dedicated to the care and the health outcomes of Michiganders. It is very significant to be at Beaumont, Corwell, Royal Oak. This hospital is a destination for people. It is where life events happen, where painful medical events happen, where recovery happens, and on. And as Oakland County's Congresswoman, who's so proud to work alongside our County Executive, Dave Coulter, and our Oakland County Commission Chair, Dave Woodward, who I know were also recognized, we take very seriously what happens here. You know, we recognize that for a lot of times families get news of heartbreak. And sometimes these are families I know. Individuals who maybe have a young child who has a medical event and all of a sudden a disability, surgeries, procedures, pain, stress, unimaginable. And yet the inner workings of this hospital and the professionals who are here seemingly doing the impossible not only save lives, but they carry families through. And what we know is that for so many families, as Dr. Carey and Mrs. Dingell shared, they rely on Medicaid. I have heard this firsthand from many families, that they would be destitute, they would be bankrupt, they would not know how they would go forward without Medicaid. These are families of all demographics, of all backgrounds, of all income levels. And it's really quite serious that we're here today having this press conference with our good governor, someone who long ago, before she was Michigan's incredible governor, when she served in the state Senate as a minority leader in a bipartisan way, leading a Medicaid expansion for the state of Michigan on the heels of the passage of the Affordable Care Act, the preeminent legislation, federal legislation in the United States of America that said, it doesn't matter if you have a pre-existing condition anymore, we will make sure you have care, and we will make sure that Medicaid is expanded. That is something that she did And now here in Michigan, we all know this, we boast some of the lowest levels of uninsured in the country. And we still want to see everyone get insured. But somehow, very strangely and very upsettingly, we have to have this press conference and pay witness to our governor signing an executive order to say that we won't let Medicaid get rolled back. How is that happening 5 years after a COVID-19 pandemic? The families who walk through this very door of this Royal Oak Hospital. I think we can reject that. And I think that we can recognize the seriousness of what this moment represents. That people deserve better. That they deserve stability and consistency and access to medical benefits. As a congresswoman in my 4th term in the United States Capitol, I'm going to continue not only to fight for Medicaid, but I'm going to continue to fight to expand it. I'm going to continue to fight for the families who walk through this door who I haven't even met. I'm going to fight for the medical professionals. I'm going to fight for the janitor who's keeping this place clean. And I'm certainly going to give you all a note of gratitude for paying witness to what we must do to continue to ensure the safety and security of all Michiganders. Now with that, I would like to introduce a colleague and a fighter for Michigan, Congresswoman Rashida Tlaib.
Thank you so much, Haley. Thank you, Dr. Carey, and thank you so much to the governor. I'm so incredibly proud of Michigan Governor Whitmer, because she leads with compassion, and that's something incredibly honorable, and I appreciate that, because we're always mothers first. I always remind people. As the co-founder of the Congressional Mamas Caucus, I'm here as well in telling you the impact of these proposed Medicaid cuts. As we sit here and preparing for the governor to issue the executive directive requiring the Michigan Department of Health and Human Services to assess the impact of Medicaid fund cuts, I want to be clear that these cuts are not just numbers. And this is incredibly important. I think that's why I think Corwell has us here, because behind every single number, every single percentage cut, every single proposal is a life. For many of our neighbors, I've never seen so many break down at town halls as much as I have seen in the past few months. This is life or death for many of our neighbors and our family and loved ones. In the Congressional Mamas Caucus, I remind folks, especially during Black Maternal Health Week, that we have a national crisis with Black maternal health. Medicaid is one of the primary ways of equity and access for postnatal, prenatal, in many births. I think over 40% of births are funded and covered through Medicaid, and that's something incredibly important. But 72 million people across every corner of our country rely on Medicaid. I don't think one congressional district in our nation is not impacted. For families and seniors and people with disabilities, Medicaid is the difference between survival and suffering. I always tell people we shouldn't always be able to have our residents survive, but they should be able to thrive. And they shouldn't have to beg our governments different levels of government to be able to do that. But I as an organizer, as a social worker at heart, I'm the eldest of 14. I've been taking care of people all my life. But one of the things that I think is important in these spaces, as we read, of course, these statistics, is to bring the people in the room that's not here, that can't be in this room right now. And so I want to share with you some stories that we got, real life impact stories that we got in our district. I carry with me the story of a grandmother in my district. She's 65 years old. She's raising her 11-year-old grandson who is autistic. He also is living with ADHD. She was promised that Medicaid would cover his care until he graduated, but now she's terrified to even retire from her job at a shipping company, afraid to lose access to critical therapy medication that he needs. Her body is breaking down, but she's holding on for him. Another constituent is one of my seasoned residents, helping her sister survive on $12,000 a year. She pays nearly $200 a month herself personally for Medicare Advantage plan, and she has to cover repairs, of course, to their home, food, and care for her sibling who depends again on Medicaid and SNAP benefits. They're not asking for a handout. I want to be clear. They're asking us not to abandon them. And let's not pretend that we don't have sick care in our country, y'all. We do have a system right now that, again, the more sick folks get, the more profit people are making. But also, it is not really built right now for, this, because Medicaid to me is that Band-Aid, and we know that we need to go beyond that. But again, these are not folks that were planning to get sick, that had plans to do this. It's not their fault, and we're abandoning them. I've also heard from a woman in my community living with MS whose Medicaid status was stripped without warning. This is the kind of recklessness that we're seeing continuing on. Her Medicare care coverage, Medicare Advantage plan is now in limbo. She told me she's so scared to the core, and I am too for many of my residents. I want to fix this right away because I know even without the cuts, just the proposed cuts is causing so much fear, so much anxiety for many of our families. They're losing sleep, but also the emotional distress on our families. I want you all to know at the federal level, the Congressional Mamas Caucus, the Medicare for All Caucus, that Congresswoman Debbie Dingell lovingly co-chairs and always talks about long-term care in our country. I can tell you we're not going to stop fighting and protecting and expanding Medicaid, but also in bringing those stories with us. Because no matter what the political background, any of them, these are people. I kid you not, like you talk to them and they were like, but what did I do wrong other than have a child? Grandson, be born with these conditions. What did I do other than the fact that I, right now have a frontline job and I don't have coverage? Medicaid is the only way I can get coverage for my child. And so again, it's important that we carry the voices of Michiganders who need more care, not less. We deserve a government that governs with compassion, not cruelty. And so again, I'm incredibly proud of Governor Whitmer, leading with compassion, knowing again the humanity that is behind, again, these proposed cuts. We're going to continue to fight together, and we'll continue to share those stories. And thank you to Corwell for allowing us to have this space to do that. With that, I get to invite a hero in our community. I say social workers are heroes, and they are. They really are. They're in our schools, they're in our hospitals, they're in our spaces, they're everywhere. And so one of our clinical social workers here at Corwell is going to speak. Her name is Liz Strong, so please give her a warm welcome.
My name is Liz Strong, and I've been a clinical social worker since 2009. I spent the first 10 years of my career working in the community mental health system, which is almost entirely funded through Medicaid. Throughout my time working in community mental health, I've had the opportunity to be a part of a number of programs which provide services for children with behavioral health challenges and their families. It is important to note that Medicaid provides services beyond just therapy to many people. When I first started out, I worked exclusively with children in the foster care or adoptive placements. All children in the foster care system receive Medicaid to help them better manage their symptoms related to trauma they've experienced and to provide support for their caregivers. Medicaid funds programs which help to create a network of support for children and their families. These support systems help to surround families so that they do not have to navigate their children's behavioral health needs alone, as well as supporting parents who may be struggling to meet the basic needs of their families. These services include transportation to and from medical appointments, psychiatric services, including outpatient and inpatient services, especially for youth, especially sometimes as young as 8 years old, who may be experiencing symptoms of suicidality, youth peer support partners, parent support partners, wraparound, respite care, case management, home-based therapy, and many more services that I do not have time to name. I would like to leave you with the story of a client I have been working with for quite some time. I met this client when she was around 7 years old, while she was in foster care. Her biological mom was addicted to heroin. I later found out that her mother suffered horrific abuse at the hands of her own father, which helps us make sense of the severity of her addiction. My client was very angry. She wanted to be with her mom. She had many oppositional behaviors. During our initial work together, she went from being removed from class frequently for her behaviors to being chosen as student of the week in her school. I left that place of work, and my client's adoptive mom was able to find me where I work now. And that client was 14 years old at the time. She's now going to be 21 this year. She unfortunately has experienced her own personal trauma, including sexual assault, and continued to have a lot of difficulty making sense of her relationship with her biological mom. Around 3 years ago, her biological mom sadly passed from an overdose after being clean for the longest time in my client's life. My client experienced a great deal of grief, but due to having Medicaid, she was able to access a partial hospitalization program and has been able to access needed medications and therapy to help her cope. My client is now on track to finish her diploma. She is actively looking ahead and considering career paths and is in the process of securing employment. This is the first time in her life when she has really been able to focus and care about her future. She would not have been able to achieve success and get needed help without Medicaid supporting her along the way. She has expressed a great deal of concern about the possibility of having her Medicaid cut off, as she continues to rely on this to provide ongoing therapy and medications for both her physical and mental health. Thank you. I would like to introduce Governor Whitmer to the podium.
Thank you, Liz, and thank you to all the healthcare providers who meet the needs of Michiganders every single day. There's a bunch of Corewell employees here in the front row, and you can just see kind of the angst on their faces as we're talking about the potential harm that this Republican budget cuts would mean for Michiganders. I want to thank all the congresswomen who are on the front line fighting to protect us from those cuts. And of course, I want to thank Corewell for the incredible work that you do, including delivering our new grandchild last week on the west side of the state. But really appreciate what you do and why it's so important. All right, my husband's grandchild. I know, you're all thinking she's way too young. Anyway, today, so the reason that we're here, we want to talk about the seriousness of this moment and the potential for this massive cut to people who get their health care through Medicaid. So today I'm signing an executive directive on Medicaid to support access for health care for our friends, our family, and our neighbors. I appreciate it when many of the speakers said this isn't just about numbers, this is about people. This is about our fellow Michiganders. This is about every single one of us. Statewide, Medicaid covers 2.6 million people. That's over a quarter of our population. In that number includes 1 million children, nearly 170,000 seniors, and 300,000 people with disabilities. Thanks to Medicaid, survivors of breast cancer can afford annual mammograms. More families than ever get dental care or visit their primary care physician. And parents can focus on getting their sick child into the emergency room instead of staying at home and risking their health because they're worried about the bill. In short, Medicaid saves lives. It lowers costs and ensures that we have a health system that can meet all of our needs, no matter where we get our health care from. And that's why we've taken action in Michigan so that more folks can access the health care they need. As a state senator, I worked across the aisle with my predecessor, Governor Snyder, to establish Healthy Michigan, Michigan's Medicaid expansion under the Affordable Care Act that now covers hundreds of thousands of people. Over the last 2 years, I've signed bills that put critical ACA protections into Michigan state law so that we can ensure people with pre-existing conditions can't be charged more. So we can allow kids to stay on their parents' health care until they turn 26 and guarantee essential services in all health plans. Earlier this year, I committed to working across the aisle to reduce the burden of medical debt for nearly 700,000 Michiganders. And there's important work to do to protect Medicaid happening outside of the Capitol, too. Thanks to organizations like Protect My Care Coalition, we're making progress in every part of our state. Right now, Republicans in Washington, D.C. are trying to terminate access to health care by slashing $880 billion from Medicaid so they can deliver a $4 trillion tax cut primarily for the rich. That's what we're talking about. If this goes into effect, the cost of health care will go up for every single American. Here in Michigan, 750,000 people could lose access to health care. The cuts will hit even harder in small towns and rural Michigan, where 37% of residents are covered by Medicaid. Behind each of these big numbers is a person, a family, a neighbor, whose lives are going to be turned upside down if this happens. Now, I hear a lot from them, people who reach out and they're fearful and they're sharing their stories. A graduate student from Kalamazoo relied on Medicaid to afford a life-saving surgery for her 7-year-old daughter, who was experiencing delayed hemorrhage after a routine tonsillectomy. A cancer survivor from Waterford used the Healthy Michigan plan to pay for his cancer treatment and his checkups to make sure the cancer doesn't come back. Terminating access to affordable health care will only hurt those who can least afford it. Seniors in nursing homes, veterans, kids, and the disabled will be hit the hardest. It's not just people's health that will be impacted, it's the Michigan economy too. Michigan hospitals will lose out on $500 million in Medicaid funding annually, threatening thousands of jobs. The equation is simple. Fewer jobs equal weaker economies and a less healthy Michigan. Hospitals in local and rural communities across Michigan will close, which threatens care for everyone, raises prices for everyone, and forces people to drive further for health care, even in emergency situations. Everyone agrees that there's always more that can be found in terms of rooting out waste or fraud. But this is not about that. This is massive, devastating slashes to core government service. This won't make government more efficient. It'll just raise your costs, eliminate local jobs, and put lives in danger. And that's why today I'm taking action to support healthcare access for Michigan families. The executive directive that I'm about to sign will order the Michigan Department of Health and Human Services to review the proposed federal cuts to Medicaid. It also asks them to prepare a report identifying the specific impact the cuts will have on people's health so we can better protect access to care and so that Michiganders know the cost of what they are trying to do in Washington, D.C. Not them, but what their colleagues on the other side of the aisle are trying to do. We're going to send a clear message to anyone trying to trade your health care for someone else's tax cut. Medicaid is not for sale. I'll keep fighting to lower the cost of health care and support access to our critical programs like Medicaid. Because if you're sick in Michigan, that shouldn't mean going broke. Let's make it official, let's sign this directive, and let's all double down on our efforts to make sure that Congress and our Republican legislators in particular hear us loud and clear. This is an important moment. We can't not fight for the people of Michigan. That's what this is all about. Thank you so much.
Awesome. All right, if I can transition the folks out here. Come up here, please, for your photo.